Okay. I'll call this meeting to order. We will start with the consent agenda. All the following items which concern reports and items of a routine nature normally approved at AHA meetings will be approved by one vote unless any trustee desires to have a separate vote on any or all of these items. The consent agenda consists of the discussion, consideration, and action on the following items. Minutes of the special trustee meeting, May 31, 2022. Minutes of the special trustee meeting on June 9, 2022. And a check report May 9th through June 8th of 2022.
Make a motion to approve the consent agenda as presented. Item 2C. Second.
I have a motion by Dr. Brown, a second by Jay Randalls, to approve the consent agenda as it was presented. Roll call vote, please.
Esford,
Yes.
Hannaford,
Yes.
Randalls,
Yes.
Simon,
Yes.
Brown,
Yes.
Bowman.
Yes.
Okay. Next up is the CEO's report. Candace.
All right, a few things. As you know, we approved in the last special meeting a Meditech as a service that is called MASS. We signed that contract. We expect to begin sometime in September, October, collecting the data that they need to move forward. And we're kicking that project off in January. So we're all excited to move forward with that implementation. The Duncan surgery team, no change in that. I have not heard from Dr. Miller at this point. He was going to go back and look at that proposal. In Reach, they are currently working on estimating our startup costs that we've asked for and do some forecasting on that. Pain management clinic with Dr. Shera. They are scheduled to be here on July 14th to meet the providers and staff. One other change, the Winoka Clinic, beginning July 1st, will be in Winoka on Mondays and Wednesdays, and then Karen will be at the Weston Clinic in Alva on Fridays to help with that, try to increase her volumes by bringing her up here. You can see some new HR reporting in your packet. Try to see those numbers, and we'll try to get those kind of condensed into a format we can review those trends going forward. Working on marketing, you can see Logan's marketing information that he's collected from the software. We have Match Camp, and we had 37 students come through, and Regina said that we had a really good crew come through this year. I was actually gone when they were here, but they were excited to share their information with those students and try to get them interested and involved in exploring careers in healthcare. Other than that, I think Chris is going to report more on the revenue side. That's all I have. Does anybody have any questions for me?
If there are no questions for Candace, I will entertain a motion.
A motion to approve and accept the Shera Medical Center written report for June 28, 2022.
Second.
We have a motion by Dr. Hannaford, a second by Dr. Simon to accept the Shera Medical Center written report for June 28, 2022. Roll call vote, please.
Hannaford,
Yes.
Randalls,
Yes.
Simon,
Yes.
Brown,
Yes.
Bowman,
Yes.
Esford.
Yes. Okay. Next item up is the CFO's report.
Okay.
Hey, hold on real quick. We would like to welcome Angelica to the hospital as well, to the medical center. And Chris, you're going to be doing the report tonight?
Yes.
Correct? All right. But anyways, just wanted to welcome her.
Yeah, I'm going to do the report tonight, and then starting next month, Angelica, we'll see how it goes. Angelica will be stepping in for the reports, and unless you guys scare her off, and then I might have to come back again. We'll see. I've got a few things under my report. Budgets to vote on, operating capital budget. I was going to run through the financial statements real quick first. I was talking with Kelly about the homestead and nursing home reports. I think he's going to go ahead and run through the financials for the nursing home. A lot of times I'll report on the nursing home and then he'll give some backup of what we're talking about. So I think we might just go ahead and let Kelly start that off so we can talk about it all at once rather than touching on it and then going back and touching on it again. So as far as the hospital goes, we're getting into the summer months with May, and every year you see May, June, July is when activity around here starts to slow down a little bit. We don't see as many patients. You can see the patient days, they were up 6 days from April, but still only at 72. The total revenue for the month, 1.3 million compared to the 1.5 million from April. Our inpatient revenue down $100,000. Kind of a screwy thing. Part of this has to do with our unbilled reports from some of the providers, and there's some other issues that are going into this. But six more inpatient days, but we're down $100,000, which looks a little strange. But yeah, part of that are waiting on providers to get all their documentation done. But still, 1.3 million, pretty low. You can look in the last 6 months. That's easily the lowest that we've had in the last 6 months. Bad debt, you can see that number went still to 149,000. That's still, we have collected on our AR. We've also written off some AR, so this bad debt entry is just adjusting our allowance for bad debt so that we're prepared. Outside of that, most of our contractuals are, some of them were lower, Medicare lower, Medicaid right around where it is. Blue Cross was a little bit higher. That's something that hopefully with the new system we can kind of track a little bit better. Right now, how we're creating our entries for contractuals by running through Meditech system and putting percentages that figure these contractuals with our new Meditech expand system that we'll have next July. Those should be figured automatically. So excited to get that piece so that we can really see what our contractuals look like. Expenses about right in line. I mean, you can see million, we were $650-ish off from last month, so right in line with where they used to be. Bottom line obviously doesn't look that great when compared to April, but April we had that large bad debt reversal that we had to perform, which kind of caused the numbers to look a little skewed. But that $343,000 loss compared to last year, not saying that that's okay, but at least historically you see around May, June, that's when you're going to start seeing the lower volumes in the hospital, which will obviously impact your statements. Along with that, Candace mentioned our revenue cycle assessment. We've been working with BKD, which BKD is now joined with another accounting firm, so their new name is Forvis. So we've been working with them for the last month on getting a better look at our revenue cycle and where the holes are. We found our unbilled, that's kind of where they've honed in on right now, is getting our unbilled accounts updated quicker so that it's not sitting there for 20, 30 days before we can actually get that out to get that paid. So I know she's been working with Michelle and the ladies down here in the billing office at really trying to work on their queues. And these queues have claims in that need to be worked so they can get sent out for payment. They've really been working hard on getting the unbilled and also the uncoded reports down where they should be. We had, like you look at the gross days for unbilled, and we're sitting at 20. Obviously, we want to have that at 6. So that's kind of the big eye opener, right? When they first look at our accounts, you can see if you're at 20 and should be at 6, there's a problem. So that's kind of where they've jumped in on to start. I think everything's been going pretty well. We're seeing accounts being worked quicker. Or we're seeing our adjustment queues going down quicker. Just in the little bit that they've been helping with us. So I'm happy how it's been going. I'll be even happier whenever we can really start to see the results of the assessment. They come on site about once a month, so they can come on, visit with all the all the employees, any questions they have, they'll stay for a few days. So I think been going really well. We'll also have a charge master review coming up to take a look at our rates and where we're sitting. That hasn't been done for several years. I believe it hasn't been done since we've gone critical access. So that will help get us in line with critical access rates and where we should be. We just had to get that contract today, so that should be starting up pretty soon. The nice thing about the charge master review is we actually, through the Oklahoma Rural Hospital, they're actually paying for that. They've gotten, Forbes helped us get kind of a grant, so that's being paid through the Rural Health of Oklahoma, so which will be really nice. You guys have any questions on the financials? Our 340B revenue, I'll get that in. We'll make sure to get that on the next one. Now that that started ramping back up and we're seeing money coming in for that 340 revenue that we hadn't been seeing for a while, since we had been waiting on our Medicare license, the certification number. I think back in it was April, we really started ramping back up to 340B and actually seeing some good money some good results from that. So.
A little higher than what was expected.
Yes.
Right.
Yes.
The providers you said are holding up paperwork. How many dollars is that?
Well, we were at.
And I guess my question is do they have a timeline that we can be more sure when?
We do, and actually, the providers, as of I think just a little while ago,
We were approaching 300,000, and I know that we got off today. We got off 165 today, and that 80 came down to 30 on that other provider. So it's come significantly.
So it's kind of a daily deal.
Yes.
You could be way in the hole and then
Yeah.
get caught up and okay.
Anybody have any questions? Any other questions? Okay. Let's see. You want to get the motion for Angelica?
So to add Angelica to the banks, we need to be able to have a motion for her to be able to receive and act and conduct any financial transactions. So we need to entertain a motion to instruct Alva State Bank, Central, and Community Bank to allow her to do so.
Got a motion to instruct Alva State Bank, Bank Central, Community Bank to allow Angelica Brady as Chief Financial Officer to receive any and all financial information and conduct financial transactions on behalf of the Alva Hospital Authority.
Second.
I have a motion by Dr. Hannaford, a second by Greg Bowman, to approve, for the approval of instructing Alva State Bank, Bank Central, and Community Bank to allow Angelica Brady as Chief Financial Officer to receive any and all financial information and to conduct financial transactions on behalf of Alva Hospital Authority. Roll call vote, please.
Randalls.
Yes.
Simon.
Yes.
Brown.
Yes.
Bowman.
Yes.
Jasper.
Yes.
Hannaford.
Yes.
Yes. Yeah, could you?
Okay. The next item is the operating budget, Chris.
Yep. I did also want to mention, I kind of forgot, with our True Bridge, the issues we have with True Bridge, we're moving to, HRG was acquired by True Bridge. I think this conversation we've had in the past. We had one of our project managers was leaving from True Bridge, so at that time we said, okay, that we wanted to switch our team to be more HRG centered. Rather than their original True Bridge team. So we're in the process of kind of giving it a last ditch effort with True Bridge. HRG had been highly recommended. So we're in the process of making that switch. Today was the first meeting with our project manager that is with HRG right now. Just a little bit, we've talked, sounds like they have a reporting system called Helix that they bring over with them. Sounds like it's going to give us a lot more information as far as KPIs that we need to meet, and keeps track of the claims, a better track of claims than what TrueBridge's RCM does. So we're kind of excited to get into that and give it one last shot, and hopefully it works out well. But the few meetings that we've had with the team so far, I've been very pleased with how they've started. So hopefully that'll go well. As far as the operating budget goes, budgeting for 2023 was a little bit different than the prior years, since I've been here anyway, because this would be the first year that we're hoping and assuming that we don't have to worry about COVID. Time will tell. But that's kind of what our mindset was going into this budget, is trying to get back to the thinking of, okay, pre-COVID, how everything looked and what we expect. That's why, right off the bat, you can see that the outpatient, you see what our current revenue is for this year and where we budgeted for 2023. A lot of that is because at the first of this fiscal year, we still had, there was a fair amount of COVID going around, so there were quite a few outpatients that we did not see, that people still weren't coming in. These last 6 months has been better with the little COVID that's been going around, but that's kind of why we projected that higher than where we're at this year. Bad debt, we're expecting to go down with TrueBridge, with this revenue cycle assessment. We're hoping that we collect more, so that's why that number is lower. Also, you can see what our bad debt is for this year compared to the budget that we had last year. That's why that number is where it is. Clinic contractuals, we base that off of current year. Charity care is the same. A lot of these most of these expenses as well, we kind of based off where we finished this year, because we have everybody in place, salaries in place. There aren't any major changes that we're expecting within the next budget year. You can tell we undershot salaries last year, so we're trying to get salaries where we expect them to be in 2023. On the next page, you have other expenses. So you can see on the other expenses line, the 1.8 million, how we came up with that. Purchase services, that was higher because we had a lot of our revenue cycle came into this year. Our Meditech Expanse implementation fee was this year, which obviously those we will not have in the upcoming year. So we had purchase services down to $1 million. Employee recruitment and physician recruitment, we dropped. That just goes in line with what I was saying about, we feel like we have everyone in place, no major changes. We've done all the recruiting that we need for the upcoming year. So we're hoping to minimize those costs as much as we can. Equipment rental, dues and subscriptions, supplies, these are the things that obviously with how everything is going in manufacturing, the increased costs that we're seeing, that's why we made a percentage increase in some of those categories, just because we know that with how things are right now, it's probably not going to get any better in the near future. The sales tax revenue, talking with Angelica, they just did a flat, how it was this year is how they're expecting it to be next year, so we kind of followed suit with our projection with the budget. Is there any questions about how we came to any other items that I didn't go over? Other operating revenue, $240,000. You can see where we were at the current year, and a lot of that were PPP loans, COVID funds, which obviously we aren't expecting any of that in 2023. So that's why the big discrepancy of those two numbers. Those are kind of the main highlights of where you see the biggest differences from year to year. Like I said, if there's any other issues or questions you guys have with that, I'd be happy to answer them. If not, that is the operating budget.
Any questions on the operating budget? If not, I would entertain a motion.
I make a motion we approve the operating budget for 2023.
Second.
Okay. Capital budget,
Hold on. we gotta-
sorry. So, got excited. Okay.
I have a motion by Jay Randalls, a second by Dr. Hannaford to approve the operating budget. Roll call vote, quickly, please.
Sullivan,
Yes.
Brown,
Yes.
Sherman,
Yes.
Jasper,
Yes.
Hannaford,
Yes.
Randalls.
Yes.
Okay, go.
All right. Sorry, I forget about that voting every now and then.
It's kind of an important piece. Might be
Yeah,
why we're here. Not sure.
I thought it was Rick's last day, maybe we can just slide.
Nice, Steve. You're thinking about
I'm
cake.
trying to get your cake, all
I
right?
understand.
Capital budget, so how we come up with this, we send out a capital budget request form to all the managers in the hospital. Let them fill it out as kind of a wish list of things that they either would like to have or things that they need based on the A, B, and C priority that they send back. And then we put that into the spreadsheet. Lab had a couple things, mainly getting their centrifuge. They would like an ortho workstation, but obviously it's the priority is not very high. It's just something that if they had some extra money, they would like to get. The hospital beds, we had this last year also, so we want to get 12 total, we get 4 a year. So we're working on getting all of the bed situation figured out. Whirlpool tub, not a high priority, something that we're working with them on, see if there's a way we can get it. The biggest issue, or not issue, but the biggest cost on capital budget is surgery. You all know that we've been talking about ortho, trying to get ortho in here. With that comes an expense of us kind of updating our surgery suite. An OR table, OR lights, the endoscopy tower, and anesthesia machine. These are all things that have come back from in reach of items that we will need in the foreseeable future. These aren't things that we would need right away. Some of these are, they've said that we can get through the first few months to see how things go, so that they have an idea of what kind of, how many patients they think they'll see a month, so that they can set that, those days. Obviously, the more patients we need, then the quicker we'll need these items. Those are the major items that we know will be coming up at some point in the next probably 6 months. Windows, we need the windows replaced. I think that's something that we're working on getting quotes that we can start working on soon. The windows in the inpatient area are all getting pretty cracked. If you walk around the outside, you can see that they're all starting to crack pretty good. And just air coming in, not really staying in the hospital very well. So I think this is an issue it's been for a while, and it's kind of getting to the point where we need to really start addressing it. As long as, same with the air conditioners. We've got several air conditioners. There's about 3, I think, above, that Brad had mentioned, 3 above the waiting area in urgent care. These said are probably the worst. And then there are a couple more towards the inpatient side that he wants us to look at. So 6,000 apiece. We got 5 of them. We're looking at getting at least a couple of them replaced this year. We'll do 2 more next year, and then the 5th one. If everything can make it for 3 years, that would be our ideal plan. And in physical therapy, I think these same 2 items were on the capital budget last year. They're not a very high priority. They would like them if they could get them, but they're okay leaving it on the budget.
So then the surgery items would all, until that deal goes through and we start working with them, they would be put on hold until then? Is that correct?
Yeah. When we know more about, I think what they say, be a couple months of them coming on before they really say, okay, this is when we need, this is what you need to buy, and this is how quickly we need it.
Start off with small procedures and then work up to being able to afford the revenue generated from those procedures.
So on this capital budget, we're approving these ideas.
Yes.
When these actual expenses come up, they will come back before us to approve those individually.
Right, so just because this budget is here, this does not mean that we are spending all of this money.
I might offer clarification that the CEO does have spending limits, that, so not all of these items exceed the CEO spending limit, so not all of these items may come back before the board.
True. Up to 25,000.
So all of surgery would, we could get some of the air conditioners without taking board approval and physical therapy, but, surgery, yes, every item that we would need for surgery would have to come to the board.
Any other questions about the capital budget? If not, I would entertain a motion.
I'll make a motion to approve the capital budget.
Second.
We have a motion by Dr. Hannaford, a second by Dr. Simon to approve the capital budget. Roll call vote, please.
Brown,
Yes.
Bowman,
Yes.
Casper,
Yes.
Hannaford,
Yes.
Randalls,
Yes.
Simon.
Yes.
Okay.
Can I just have a quick-
Yes.
Chris mentioned something about the windows, and it reminded me, if you have been on the south side of the building up top, you'd notice that we poured a bunch of cement right there by that south nursing entrance, and that seems to have solved our basement water issue that we've had for years and years, because we've had a lot of rain at that one time, and we didn't get any water in the basement, so hopefully that's taking care of that issue.
Very good. All right. Thank you, guys, on the CFO report. Next item is the Medical Staff Executive Committee. Dr. Scott Burke was not able to be here this evening, but we do have two items on the credentialing committee that need to be approved. First one is the reappointment to courtesy staff, Matthew Jared, MD.
Make a motion to reappoint courtesy staff, Matthew Jarrett, MD.
Second.
Have a motion by Dr. Brown, a second by Jay Randalls, to reappoint to courtesy staff Matthew Jared, MD. Roll call vote, please.
Bowman,
Yes.
Casper,
Yes.
Hannaford,
Yes.
Randalls,
Yes.
Simon.
Yes.
Brown.
Yes.
Okay. Next item is the reappointment to courtesy staff Adam Gardner, MD.
Make a motion to reappoint courtesy staff, Adam Gardner, MD.
Second.
Have a motion by Dr. Brown, a second by Jay Randalls, to reappoint to courtesy staff Adam Gardner, MD. Roll call vote, please.
Casper,
Yes.
Hannaford,
Yes.
Randalls,
Yes.
Simon.
Yes.
Brown,
Yes.
Bowman.
Yes.
Okay. That's your care. Yeah.
It's all 100%.
So you do have your compliance review, contract review, back there under patient care. All of the contracts and renewals were all at 100%. Any questions about that? If not, we will move on to Sure Convalescent Home Report. Kelly?
I'll start with the financial statements. Operating cash balance for May, and then I'll just point out that, I'm not going to read all this word for word, but we are just under $400,000 in the operating cash account, and then we also have a refurbishment account, which we've been putting back funds for COVID, from COVID primarily, that we've received, and that has given us roughly $800,000, a little bit more probably, but that's money that we've put back for the HVAC project, which is, again, is going to be in the capital budget when we approve it here in a little bit. But cash is pretty good right now, but it all could be spent very quickly, depending on how that project comes through. So accounts receivable is down from the prior month, about $18,000. We are still working some old uncollected accounts that are of significant value, so hopefully we'll see some action on that. Doing good on payables. We're paying bills every couple of weeks or so and staying on top of that without any problem. Revenue was slightly up compared to the previous month. It was up to 234,576, and total patient days were also up slightly. The operating expenses were pretty much even with the just over $2,000 increase from the prior month, and salaries and wages.
That's a typo.
That's a typo.
Just saw that. 159,814. I don't know how there's another one in there.
And-
Not 1 million.
Yeah. We did not have $1 million worth of wages and benefits in the month of May.
Just saw that.
So $159,000, it was an increase of about $9,000, but if you look at, when we get to it, I'll point it out. But the 6 months side by side, you'll see that April and May are significantly lower than the previous months. We did have a net operating loss of $41,574, and I'll explain why that was here in a second. On the 6-month comparison, the biggest change is with regard to our Medicare contractuals on our revenue side, or reductions in revenue. This was our lowest, because our contractuals have been running in a negative, that actually amounts to more revenue for us. But this was the lowest negative amount that we've had, so that affected our revenue more than most, and that is directly related to the volume that we had with Medicare. We went from 141 skilled nursing days in April to 60 skilled nursing days in May. So while our total patient days did increase, when our ratio of skilled to non-skilled changes like it did, that really impacts our revenue. So revenue was down, or revenue was up, but not compared to, or net revenue was not up. Operating revenue was up, net revenue was not. Expenses, like I said, you can see there in the salaries that we've the last 2 months been under $160,000. That's the lowest we've been this fiscal year, and that is directly related to the changes we made in our staffing. We're staffing more people, but we're staffing more people at that direct caregiver level, the nurse aides, med aides, and fewer licensed nurses. And so we've got more people taking care of people, but they come in at a lesser salary. So that's good.
And Kelly, remind me, seems like I had looked at a report at some point, that's just the reverse of what you had tried previously, and it did not pan out that it improved.
Right, we had tried to, the notion or the theory we were working on, because we weren't having the outcomes that we were wanting prior, and so we felt like that if we hired more qualified staff and put more qualified staff more often on the schedule, that we would see better outcomes, and we didn't. And so the emphasis now is getting more people altogether on the schedule, and that the aides who do 95% of the direct care for our residents, get more of them so that they've got plenty of help to go in and out of the rooms more often, and have more frequent touches with the residents is actually showing to result in higher levels of satisfaction and higher levels of patient care. So not only is it good for the budget, it's good for our outcomes. And so it wasn't anticipated that would be, we really felt like having a licensed nurse whose scope of practice includes everything from, assessments and evaluations down to, assisting with ADLs. They can do all of that. It wasn't occurring like that. So, because we didn't have as many people on the schedule, we decided, it was a conscious decision to switch that up. And we are seeing that the people that have the most impact on the residents' quality has been our direct care staff. So it's not that we don't value our licensed nurses, it's just that their assessments and the paperwork, the documentations, regulations regarding documentation are crazy, and so they are tied up doing that sort of thing, and so we've just shifted the balance, and it's working. So, we do continue to see an increase in supply costs. You can see the annual comparison. Well, that's not. It looks like we've been pretty flat with our supply costs, but our census has declined by about 6 or 8 residents. So when you do per patient day, our expenses have increased quite a bit, especially in the supply area. You can see the balance sheet. Before I get into the rest of the report, are there any questions on the finances? So like I said, our average daily census decreased slightly, but our total patient days increased slightly, and that's just because there's 31 days versus 30 from the previous month. The biggest change was in our Medicare admissions. We had 2 actual admissions and 2 deaths, so they canceled each other out. And then we had a handful of people that transferred between different levels of care or to another facility for care, whether that's a hospital or what have you. Our quality measures, we still are working on some things with UTIs and because we're just a little bit over the U.S. and state average for that. But everything else we're, doing. Actually, our pressure ulcers in the month of June, we pretty well kicked that. So we should see that number reflected when we get future reports on quality measures. So satisfaction numbers in most categories increased, like I was saying. I do want to point out our nurse call system. We've really had a conscious effort, both with having more people on the schedule, but also with emphasizing how much time we should spend responding to a call. And 2 minutes and 58 seconds is about half what it was 3 months ago. So for an average response time to be right there, that's as fast as I want to be. And I want to actually maybe get that closer to 3.5, 4 minutes, because that will mean that my staff are spending more time with each encounter, but it won't be so long that the residents feel like they're waiting too long. So we slightly overcorrected. We'll back up and focus more on what we do when we're in the room with the resident, and we should see our average response time increase, but it's okay. And if you look at the second page, when I talked about, you can see right there in that chart, the total salaries for direct care staff. That was below $100,000 for the first time in several months. And our cost per patient day for direct care staff was also below, it was below $100, and at $92, that's about as good as we've been since I've been at the facility. So for the volume that we have and what we have to have for direct care staff, we're doing really good on those costs, and Tiern's done a great job with that team. So that's kind of going on there. I will let you know that the state of Oklahoma, their survey crew was out last week, and they have not yet sent, Candace, I know sometimes they send it to you, so check your email.
It's true.
But the 2567 report that has the deficiencies in it, they haven't sent that out yet, but in the exit interview, we didn't have any deficiencies that would have triggered a harmful event. Our deficiencies were, documentation related. We had a couple of facility issues that we need to take care of, but we'll get that full report and I'll be able to share that with you. But I anticipate probably our last survey was in 2019, and I anticipate probably half to a third the total number of deficiencies as we had in that survey. So I really want to publicly thank and let you guys know that I've got some real rock stars over there, and if you have opportunity to see any of our staff, you might let them know that they're doing a good job, because they are working their tails off. But my leadership crew over there, Tierney Adair is our DON, Brooke Williams, our infection control nurse. Amy Kimberly she really does everything, but right now her job is HR coordinator for our site, and so they're all doing a great job, and made this survey process. They were in and out in 3 days. Last time they were there for 8, so it went real well, and I've got a really good crew making sure that happens. So. Everything else I think you can read in the report just fine, but I am willing to answer any questions you might have.
Any direct questions for Kelly? If not, we'll move on to the approval or disapproval of the operating budget.
So basically, Angelica, I can't remember what percent it was pretty close to the CPI. Okay. We are, basically seeing an increase in expenses that is consistent with what the CPI has been, so that's kind of what we based our budget on. And when I say consistent, I use that loosely. Some things have been all over the place, but it's averaging out to about that 8%, and that's where we put the budget. We had a higher rate increase in in January of 2022 to account for increased inflation, and we'll probably have another higher increase in rates the next time we increase rates as well, just because we're starting to get a little backwards on the revenue versus expenses, and it's we feel pretty confident that we've taken advantage of whatever efficiencies we can over the last couple of years, and it's just inflation, and it just is what it is. And so we're just kind of, that's what our budget's based on. We're looking at gross revenue of $3,117,839, with total operating revenue at $3,975,273. Our total operating expenses are going to be $3,942,538, and that gives us a net income of $32,865. We do, like I said, we anticipate some of our expenses going up more than that 8%, but I anticipate our salaries to, if our census stays the way it is, our salaries are going to stay about the same as they've stayed the last couple months. So that's that's the operating budget. I'm happy to answer any questions.
Any questions for Kelly in regards to the operating budget? If not, I would entertain a motion.
I make a motion to approve the operating budget for the sheriff convalescent home.
Second.
We have a motion by Jay Randall, a second by Dr. Hannaford, to approve the operating budget. Roll call vote, please.
Hannaford.
Yes.
Randall.
Yes.
Simon.
Yes.
Brown.
Yes.
Bowman.
Yes.
Casper.
Yes. Okay. Next item is the capital budget for the convalescent home.
The capital budget, there's not anything new on it this year that wasn't something that we asked for last year. Like I mentioned, I'll start with the HVAC project. That's the biggest, most needed ticket on the list there. We have that slated at $750,000, but of course that'll be a bid project. We'll see where it lands and go from there. It may be something we have to phase. It may, we'll see how that goes. But that's the biggest ticket and the greatest need. As we continue a discussion regarding 100% private rooms, one of the measures that we would want to take is converting some of our west wing rooms to where they would be showers in the room. So 2 rooms would share 1 shower, and so that's on there, not as a high priority, but something that would be moderate, make our marketing efforts probably a little bit more fruitful. People already like that our rooms are bigger than a lot of rooms, and if our volume is going to be around where it's been, we have plenty of capacity to do private rooms, and this might just make it for a better selling point, a better price point from a revenue standpoint. So that would be the intention.
How many?
8.
8 single rooms? No.
8 single, there would be, 8 shower conversions. So that would be 16 rooms.
Okay.
Yes. And that price is, honestly, that price is probably low. So that price is definitely low at this time. But, and that would take care of the whole west wing. And so, if we had to reduce the scope of that, we would reduce it down to the short hall on the west wing and do that there. The other items are beds and rolling recliners. We got some beds last year. We can get some more this year. Our beds aren't as complex as the hospital beds, so that's why you'll see a price difference there. The surveyors frown on rails on nursing home beds, and so we don't get all that stuff. If they go up and down and the head tilts and feet tilt and all that, that's about all we need. So that's what's priced there. The beds are a lower priority. The rolling recliners are a higher priority, and so that is the capital budget as requested. Any questions?
Kelly, I just have one. On that HVAC deal, when do you think that they would be going to bid on that?
I'm starting to think we may need to switch engineers,
Okay.
and so I don't have a good concrete number. I'm on the 3rd engineer with this firm.
Okay.
They've submitted 100% plans, but I don't agree with them, and so I haven't got them back out to do anything else. They haven't gotten paid for the last bit of their work either, but there's a section of the building that I don't think they've planned it properly. And based on my conversation with our Brad and our maintenance staff, I don't think they planned that section properly. I need to get them back out to look at it again, and I can't get return emails, let alone a return visit. So.
Any other questions for Kelly in regards to the capital budget? If not, I would entertain a motion.
Make a motion to approve the capital budget for the sheriff convalescent home.
Second.
Have a motion by Dr. Hannaford, a second by Jay Randalls to approve the capital budget for the convalescent home. Roll call vote, please.
Randalls,
Yes.
Simon,
Yes.
Brown,
Yes.
Bowman,
Yes.
Casper,
Yes.
Hanford.
Yes.
Okay. Next is the homestead report.
So the homestead financials, their revenue was up compared to April, but really kind of low to average compared to the other months that they've had. $56,450 was their gross revenue for all their services. The expenses at the homestead, is that a typo?
No.
No, the other.
I might need your help then.
Yeah, the other expenses, when we initially bought the van, it was charged under the other expenses. If you look in April, you see the 39,000 other expenses.
Okay.
That actually should have been capitalized, so it was taken out of other expenses and put into major movable equipment for depreciation. So that's why it looks that way.
So, yeah, so the month before we had a bigger loss than
Correct.
would have been reported, and then this time we have a bigger net income than would have been reported. So you take those two together, it's probably closer to what we've averaged the last couple of months. Would still be a slight loss, but you can look at the next page, and our year-to-date comparison. The homestead is in the black, not by as much as what we've been used to in previous years. But they also have had a decline in census, and so we're starting to put some effort into marketing and that sort of thing. But are there any questions on the homestead financials? If we go to the just the homestead report. We averaged 28 paid nights, and so that was 867, which was about a 6% decrease from the previous month. We did have maybe this happened in June. I thought we had, I know we've had some term contracts. We had one resident whose family moved out of Alva, and she followed her family. We've had, I think there was, this all may have been, oh, this is the April report. Okay. Well, I'll get that corrected for next time I report. But they have had, I didn't mention it during my report, but we have seen a little bit of COVID in our staff. We haven't seen it in our resident populations, but we've seen a little bit of COVID in our staff. And so we're working through that. But other than that, it's kind of business as usual for the homestead.
Okay. Next item for the homestead would be the operating budget.
The operating budget for the homestead, similarly to the nursing home, looks like our, wages and benefits are going to probably, with our just for market adjustments, have about an 8% increase. We're looking at probably having about that same 8% increase in rates. We've been, as far as market comparison is concerned, for the state, we're generally priced about a half to two-thirds of what an independent living facility is running in other parts of the state. So continuing to increase our rates doesn't worry me much. We're still going to be competitive. I think our census decline is not going, I don't think it's going to contribute to more of a census decline, because I think if they're looking for that service, they're not going to find a better bargain than what we've got. So we do anticipate that increase. It'd be about a 10% total increase in revenue with, you know, a slight increase in meal revenue. But anyway, the total budget for revenue for 2023 will be $725,209. Expenses, you can see salaries are up. We're up in pretty much every category except for the other expenses, and that, I think probably that's still being impacted by the purchase of that van. And so overall, the total operating expenses are going to be $638,667. Which will give the homestead a net income of $86,542.
If we do get an increase in our census, do we have with the current number of employees that we have, cover even an increase in?
At the homestead?
Yes.
Yeah. Homestead, when you increase census at the homestead, your utilities go up and your supplies go up, but it takes the same amount of staff.
Okay.
Any other questions? If not, I would entertain a motion in regards to the operating budget for the homestead.
Make a motion to approve the operating budget for the homestead.
Second.
Have a motion by Jay Randall, second by Dr. Simon, to approve the operating budget for the homestead. Roll call vote, please.
Simon?
Yes.
Brown?
Yes.
Bowman?
Yes.
Casper?
Yes.
Hannaford?
Yes.
Randall?
Yes.
Okay, Kelly, thank you. Next, is there anything from the foundation?
Not this month.
Okay, very good. Next item is St. Anthony's report. Bridget,
Okay,
nice to have you.
thank you. I appreciate y'all allowing Barb to come in my place. We've been trying to divide and conquer as much as we could with Cindy being out. They probably shared with you, but my boss got in a terrible accident, and so she's been out since, late April, I guess. But I think she's about to the end of her journey, so she goes back to see if she can get released to work July 11th. So I will be extremely happy if she can get back on board. I'm pulling double duty, and I find myself there a lot sometimes, so but I'm ready to get rid of this double duty. I'm just going to let y'all know what our COVID numbers are doing currently right now. About June 9th, I think, is when I left for vacation. I looked at the code numbers before that, and it was like at 4, and it jumped up when I got back. It had jumped up to like 19. So we've been staying about 16 or 17 patients on the inpatient floor. We haven't had to open up any wings yet, so it stayed kind of flat in that number. We're hoping it stays right there. We're experiencing, still experiencing staffing issues as everybody's fighting for people in the metro area. So we haven't seen a lot of it in our rural hospitals, so hopefully it'll stay as much out of the rural areas, or at least not put people in the hospital if they're getting it. So we did officially bring Seminole Medical Center on board. Their official opening date will be July 11th under SSM, so we're glad to have them as part of our team. We continue to work on the Access Center for our transfers. Our capacity issues have been something that we've been working on for a while, but with Shawnee Hospital and Midwest City Hospital, it appears the last couple of months that when our affiliates are calling, we're able to get them beds by shifting as far as putting people in the right beds, I should say, because all the specialists are up at our main hospital, and then we have them kind of filtered out through the rest of them. So sometimes they just only need kind of a marginal amount of additional care, just enough to get out of your scope. and they're fine at Midwest City or Shawnee being taken care of because the specialists are close by. They're just not all there in the same facility. So we're really working on trying to open up those beds because we're constantly full, and Midwest City and Shawnee has beds. So we're working really hard. So hopefully, if that trend continues, we can get back out and start encouraging the physicians to give us a call again, because we know that it's been frustrating and some people don't want to call us anymore. So we're aware of that. We continue to work on it. We have our software in place this next quarter to try to streamline all of that within Epic, so it's not a manual process anymore. So I wanted you to know that that is important to us, and we are continuing to work on that. Also, a lot of the rural hospitals in Maine were experiencing losses, and I think it was just a really bad month. Most of them have lost about the equivalent amount of money, percentage-wise, that your hospital did. I think it kind of got some of the boards a little antsy during the month, but I think it'll stabilize with time. We've had those big kind of COVID rushes, and then kind of everything died out. I think everybody's catching their breath right now, which is good, bad, and indifferent, I guess, as far as we're concerned, running our businesses. But it is nice to kind of have a little bit of a break, even though it is showing a loss on the books. Hopefully a lot of your staff is getting an opportunity to kind of get a minute. On the HVAC stuff, y'all probably already know this, because I don't know what's happening in this neck of the woods, but in the metro area, it's a huge problem, because we have several hospitals that have HVAC projects, and they're struggling.
There's one at the Homestead. I didn't mention that the city's got to get a unit for the Homestead, and it's, one company told us 35 weeks.
I just want to throw that out there, that it's a global issue, and it's a big issue because you can't go without HVAC, obviously, for regulatory. So I don't think anybody has a solution for it, but it's out there. So I hope that y'all are luckier than most in this area. But the ones that are tied up in the metro area, they're struggling a lot. A lot on delivery, a lot on having the staff to, once it comes in, to get it done. I think that's pretty much all that I wanted to share, unless y'all have any particular questions.
Anybody got any questions for Bridget? No? All right. Thank you very much. Next item is the City Council's report. Greg?
Okay, we've got some things going on. The 4th Street is complete. Fire department is back in the house. If you haven't had a chance to look at it, they did a really nice job. We got a handicap ramp going into the professional building. Got a new sanitation truck. I'm sure those guys will appreciate that. We've got an applicant for the business manager that the committee is very high on. That's about all I can tell you on that. Hopefully we'll be having some interviews shortly. We almost have a budget. We've got a couple of loose ends we've got to take care of, and the city will have a budget for 23, hopefully after Wednesday.
Oh, those aren't budget items Wednesday.
I thought it said budget items.
They're just grant stuff.
Oh, okay. Anyway.
We got a budget.
Okay, never mind. The budget's good. I misunderstood the email, so that's about it.
All right. Thank you. Next item would be the chairman's report on your next page. As we mentioned last month, somebody thinks they need to retire. I think it's just be bored, but anyways, no. We do wish him the best, and we'll talk about him maybe here in a minute. But we need to replace him. Drew Cunningham reached out and is interested in filling that position. And so we talked about this as well in finance, and we believe that Drew would do a good job of replacing his father as our attorney for AHA, but we need to discuss and act on that.
Very good.
I'd like for him to be employed. Give me the job. I can tell you, he's been here 5 years practicing, which is surprising to me. And he is very, very busy. He's doing a lot of trial work and seems to be pretty confident in getting those things done. So of course, I'm a little biased. I think has the professional skills to do the job. He will be like, I think, any local attorney coming in. He's had some background, some HIPAA and some of those things. He won't be familiar with the day-to-day operations, but I'm sure Candace will take care of that very quickly. But
We like that he has a historical background at his fingertips, so.
well, and that is, he probably, other attorneys might not want to call the former attorney and say, give me the background on this project or this situation. He won't have that call.
Very good.
So that's what I like to do.
Are we moving to approve or not, or?
Yes.
Okay. Sure. I move that we approve hiring Drew Cunningham as the Alva Hospital Authority Attorney.
Cool. I'm going out of my left ear. Hey, Hannaford. I don't know who the other person was. Okay. I have a motion by Dr. Simon, a second by Dr. Hannaford to approve the hiring of Drew Cunningham as the Alva Hospital Authority Attorney. Roll call vote, please.
Brown,
Yes.
Bowman,
Yes.
Gasper,
Yes.
Hannaford,
Yes.
Randalls,
Yes.
Simon.
Yes.
Okay. Very good. Trying to let him know that we fired him. Okay, next item is election of officers. We need to fill the chairman position, vice chairman, and secretary.
Somebody lock the door.
I would nominate Jason Gasper as chairman of the board.
Second.
And when you say nominate, I assume that's in the form of a motion.
And I make a motion to nominate Jason Gasper.
Second. Again.
A motion has been made by Jay Randalls, a second by Dr. Simon, to elect Jason Gassford as chairman of the board. Roll call vote, please.
Bowman,
Yes.
Gasper,
Yes.
Hannaford,
Yes.
Randalls,
Yes.
Simon,
Yes.
Brown.
Yes.
Next item is vice chairman.
I'd make a motion to elect Dr. Bo Hannaford as vice chairman.
Second.
I was gonna say, I'll chat before.
You hear that, her whistleblower?
We have a motion by Jay Randalls and a second by Dr. Simon to elect Dr. Hannaford as the vice chairman. Roll call vote, please.
Gasper,
Yes.
Hannaford,
Yes.
Randalls,
Yes.
Simon,
Yes.
Brown,
Yes.
Bowman.
Yes.
The next item is secretary.
I'd make a motion to elect Dr. Hale Simon as secretary.
Second.
I have a motion by Jay Randalls, a second by Dr. Hannaford to elect Dr. Simon as a secretary. Roll call vote, please.
Hannaford,
Yes.
Randalls,
Yes.
Simon,
Yes.
Brown,
Yes.
Bowman,
Yes.
Gasper.
Yes. We have one more item. Rick has been our attorney here for AHA for longer than any of us have maybe even, Candace has maybe worked here as long as he's,
How long's it been?
24 years.
yeah, she has worked here as long. But he's been on this board longer than any of us. My first board meeting was almost 19 years ago, and I sat right in that chair, which was Dr. Shorter's chair. And Rick, I think you actually were sitting next to me then. And
I was probably asked to.
that very well could have been the case. But
Quick.
you have always been there for every phone call, text, email, to serve this board very well, and you have served this community above and beyond. And so we want to say thank you, because you have done a fabulous job, and your son will have some big shoes to fill. Okay.
Dilly dilly.
And I can give his number, by the way.
We have a little gift for you to just say thank you.
Okay. Well, I will tell you that this board is, if you're an attorney, this board's a dream to work for. It's had good people, some of the nicest, brightest people in Alva, Oklahoma have served on this board. I've served with a bunch of them over the years, and I can tell you it's been an honor. It's real humbling to have the opportunity to be employed by the Alva Hospital Authority. So I appreciate that.
I have to say, Rick has never failed me, whether it be a text or an email or a phone call, whatever time or day of the week. I appreciate you always being there and answering all my questions and giving advice on an issue.
Well, I'm still
You're not
gonna be
going
there.
anywhere though. I'm gonna miss your humor too, your quick humor.
Oh, well, very nice. Travel vouchers for $1,000.
That's for you and Janet to spoil yourselves on the boat.
Okay. I don't think I earned that, but I
Yes,
appreciate
you
it.
have.
Thank you very much.
And we hope that you enjoy it.
We will.
And apparently Chris has been hoping you'd hurry up and cut the cake, because he was trying to get to this meeting a lot quicker than the rest of us. So we also have a cake back there in your honor that we can all partake in.
Very good.
Unless you want to take it home with you and we just don't
I
get
do
it.
not.
Chris might be disappointed.
This will fly you home.
There are no other items of new business. No, you're.
July meeting?
Oh, yes, thank you very much. We will not have a July meeting.
You still want to give me the cheesecake?
2 years in a row. Okay,
I didn't think you'd pick up on that quick.
Can you please make note to somebody that in August, we have to have cheesecake as our dessert? Can we get that in the paper? Of all the notes we took.
I'll let Marion know.
We have to celebrate Kayla's birthday. Okay. So we're adjourned. So no meeting in July. We'll see you in August.